Mental Health Forum this month. We are so pleased for you to be joining us either in person or online. Over the past 3 weeks, we've discussed issues like compassion fatigue, social isolation, health equity, and other psychosocial strains on our mental health. We're here today because October is the time of year to pay attention. Studies show that online search terms like anxiety, fatigue, depression surge in October. October is broadly recognized as Depression Awareness Month, and Mental Illness Awareness Week is October 3rd through October 9th, and World Mental Health Day is October 10th. This is the time of year to pay attention, not only to each other, but to ourselves. As a community, we can support each other through this hard time. Today, we are talking about mental health so that we are collectively more aware of how we feel and know how and when to get support. Before we kick off this final discussion, I want to share with you resources available to you at Rush should you need support. The wellness pathways pictured here are an easy way for you and your colleagues to get the right help right away. Starting from the bottom to the top, you will see scaled responses based on how you may be feeling. Know that as a Rush employee or student, you can always access direct support from mental health professionals. Let's use these pathways, these forums to acknowledge that it's okay to not be okay, to acknowledge that we can support each other in our time of need, and to acknowledge that you are not alone. I'm delighted today to introduce our moderator, Dr. Brenda Phan, to kick off this forum today. Thank you again for being here and taking time for your well-being.
Hi, good afternoon, everyone. I'm Dr. Phan, as Eve said, and I'm the Assistant Vice President of Medical Affairs at Rush Copley. And for our Rush Copley employees, you also probably know me best over the last 18 months as the Employee Health Services Medical Director. So you've heard me talk about COVID nonstop. But today, I'm excited that we have another really important topic to go over. And I'm going to introduce our panelists. So we're going to start first here with Dr. Jamie Lewis. Dr. Lewis is a palliative care medicine physician who focuses on supportive oncology at Rush University Cancer Center. She became an attending there in 2013 after finishing a fellowship in hospice and palliative care, as well as residency in internal medicine. She serves as a faculty advisor to the medical college and, interestingly enough, a registered yoga instructor, and leads classes for Rush staff, patients in the cancer center, part of the RU Well, which is the Rush University Wellness Group, and Rush Generation. So welcome, Dr. Lewis. Thanks for coming out. Next to her, in the middle, we have Dr. Hayes. Cynthia Hayes is a licensed clinical psychologist and holds a part-time faculty appointment in our very own Rush Copley Family Medicine residency program, as well in our rehab center upstairs. She has served on our Rush Copley Wellness Task Force that was started in March 2020 after the pandemic started to help meet the psychosocial needs of our employees here. In addition to what she does here, she has another job in a private practice in Hinsdale, Illinois, where she specializes in comprehensive neuropsychological assessments for children and adolescents. So welcome, Dr. Hayes. And then next to Dr. Hayes, we have Zinal Patel, who is a licensed clinical social worker and psychotherapist with the Department of Social Work and Community Health at Rush. Zinal aims to help patients bridge the gap between mind and body, which really directly impacts how folks feel both emotionally and physically. So we're going to go ahead and get started. So just for those of you who are online, we have many of you online and we have several in the room here. We're going to address questions at the end, but if there's relevant questions that come up in the middle of something, we are happy to take them during the presentation. For those of you online, you are welcome to submit it via the chat function, and Eve will flag me down to let me know that we have a question, and we'll try to address it at that moment or at the end of the presentation. We're absolutely going to leave time for questions. So I'm going to start out with some questions. So the first question for our expert panel, stress is often associated with the mind. We think about, I'm just so stressed out. People even go to their head like this, I'm just so stressed. But there are a lot of physical aspects to stress. So what are those somatic or physical manifestations of stress?
So I'll start with answering that question. And just like you mentioned, usually we're thinking of only
We're not able to encourage her.
mental stressors. Can I hear me?
Yeah, you know what? We have the handheld. Did Todd leave us? Can we use this, Todd?
I just have to turn the volume. Thank you.
So we're going to get Todd to help us with volume to make sure that we're okay here. I didn't introduce Todd as a member of our panel, but Todd is from our IT department and has worked at Copley for many years and has helped us all. He has saved my computer from going out the window when it wasn't working before. So we'll just give us a moment here while we fix the volume. Do you want to come up maybe to the mic since you're so close while we're waiting? Oh, he's got it. Todd very well may be one of the more important people here today since he set everything up. So thanks to Todd. So the question was about the physical manifestations of stress, and Dr. Lewis is going to go ahead and handle that question.
All right, how's that?
Okay.
All the thumbs up, we're good. So yes, just like you mentioned, we're usually thinking about more of our mental stressors, but it's important to realize that just within our stress response, so whether we're exposed to an actual physical or physiologic stressor or a mental or emotional stressor, our body is going to respond in similar ways. So I won't bore you all with the physiology behind our stress response and just all the hormones involved, how our immune system gets involved, our nervous system gets involved, but just what happens when all those pathways kind of happen. What we feel in our body from a somatic standpoint is first maybe that tension, right? You may feel some of that musculoskeletal tension. As our heart rate increases, our breath rate or our breathing rate increases, we start to become tight in our body. That is that response of our body trying to protect ourselves. So long time ago, like our stress response, think of it like caveman days. So whenever like there was an immediate stressor or danger, they had to flee. So they weren't really thinking about like GI systems or their GU systems, like all those systems were on hold. They're like, I need to run. And so that's what our body is preparing for when we're exposed to even a mental or emotional stress. Oh my goodness, I need to act. I need to prepare to act. So just think about over time, if we're constantly exposing ourselves to, or we're constantly experiencing, I'll say, a stressor, whether it's mental, emotional, or physical, our body keeps going through that repeated response. And over time, that can actually burn out our nervous system. It can negatively affect our immune system. And this is when we start getting into chronic stress. So there is such a thing as repeated acute stress and chronic stress. And over time, what that does somatically is it can place us at risk for a lot of chronic diseases. So we see a lot of research and literature these days that chronic stress can lead to increased risk of cardiovascular disease. So hypertension, high blood pressure, high cholesterol, increased risk of heart attacks and stroke. It can affect our sleep. We have insomnia or maybe sleeping too much because we constantly feel like we need to catch up. It can also place us at risk for other psychiatric issues like depression or generalized anxiety disorders. So just being aware that when we feel those kind of acute somatic or physical symptoms of stress, we'll talk more about with other questions later on, how that can manifest over time and how we can start to combat those acute stress symptoms when we feel them in our body, so we do not put ourselves at risk for chronic stress and chronic disease.
Thanks, Dr. Lewis. So I think all of us are very familiar with stress, especially in healthcare in general, and then add the pandemic onto that. It's been quite a stressful last year and a half or 2 years almost. In thinking about stress and its manifestations, different people do show their stress differently. Sometimes someone can be really stressed and you can't really tell. And other times you can see really someone is very stressed. So Zanal, I have a question for you. How does stress manifest differently, maybe in men versus women? Do you want to talk a little bit about that?
Yeah, so it's interesting. There are several differences, and I think the piece that I'm going to talk a little bit further about is in how it's being reported and who it's being reported to. It's very common for women to kind of share their emotional experiences, but data actually shows us that women are more likely to disclose their symptoms to their primary care physicians, whereas men tend not to do that. Also, the types of symptoms that women are more likely to experience and report are symptoms of depression, anxiety, and more of those somatic complaints. And it's interesting because men, on the other hand, will actually be more forthright, talking about the use of substances or any type of substance dependencies, the use of and how much and how frequently of alcohol and different types of substances that they're using to cope with maybe said depression or anxiety. And the interesting thing is that we often see that women are more likely to seek out supports and services actually from mental health providers. I've been a social worker for 10 years, maybe a little bit more. And the majority of my clientele has normally been female. And I think that speaks volumes to just some of the stigmas that are out there, some of the messaging that happens within our society regarding, who needs that support versus who doesn't, who should seek out that support versus who shouldn't. I'm sure we've all kind of heard that, a lot of messaging where like women are just more sensitive and more emotional. To be a strong man, you don't show any kind of emotional weakness. And I think a lot of those things do get in the way of being able to seek out some of these very necessary supports that are out there that could be really helpful for folks. Another thing to also mention is that when it comes to suicidality, for example, men are more likely to follow through. And that's a scary data piece that's out there that tells us a lot that men are not actually receiving the supports that they need when it comes to their mental health. There's more isolation, feeling judgmental towards themselves. What kind of man am I if I am not able to take care of what's happening in my life? What's it mean to go to therapy? What's it mean to actually ask for help? So those are some of the pieces that I wanted to bring some attention to because I think they're important. There are obviously several differences in terms of how stress comes out both in the genders. So
Thanks, Sanal. And I think Sanal highlights a few really key things. It's not a one size fits all response or approach to stress and mental health. I think there are some generalizations that sometimes we assume that men aren't telling and I think it's important to normalize this for everybody. And I think in healthcare, not only do we have those stresses of healthcare, but then a lot of us still have families and we're parents or, a spouse, and there's all those extra pressures outside of work that are adding to stress. And I think it's hard as a healthcare worker when we have a patient maybe who's not doing well or they're stressed to get things ready behind the scenes, maybe in, let's say, sterile processing, because there's a lot of cases and we got to get things moving quickly. I think for a lot of folks, it's difficult in healthcare to say, I'm not feeling well, or my patient just died and I'm struggling with that. And I've seen now my, yet another organization pass. So the stress does add up. And Dr. Lewis talked about the chronic effects of stress. And I think two other things that's all added on to that list are the self-medicating risk of turning to drugs and alcohol as a way to cope. And then also the suicidality of that. And that's really a big deal because, as you said, men tend to commit suicide more. Women may attempt more, but they aren't necessarily as successful, so to speak. The men will are more likely to commit suicide. Cindy, Dr. Hayes, I'd like to ask you just a little bit about that, and just in terms of recently, last week, our community out here in Aurora is still reeling from a suicide death of a high schooler at one of our local high schools. So tell us a little bit about.
Oh, no, of course.
Excuse me, I'm so sorry. It's a hard thing to think about.
It very much is, and it touches, the family, it touches the school community, it touches all of us. And especially in healthcare and in mental health, it cuts us to our core when we see young people get to the point where they're so stressed, or they have got feel such burdens on themselves that they feel that that's an option for them.
So, I mean, for us who are parents and healthcare workers, I think we try to role model for our kids' strength and how to handle stress. But for some of these kids and teenagers, how do we recognize how stress manifests for them? What kind of tips do you have for us along that front?
Definitely. So children as well as adolescents can present stress very similar to adults. They can have anxiety and depression, but oftentimes they don't have the language or the kind of cognitive ability to kind of identify what's going on for them. And so they miss the language piece. And so what you will oftentimes see is their stress is or their emotional discomfort is coming out of behavioral change. And so you'll start to see difficulties in sleeping. You'll see, tantrums or withdrawal. It can manifest itself in many different ways, but oftentimes I'll say to families or to anyone that I'm talking to about mental health in children and adolescents is look to see if there's a change in their regular behavior or how they are kind of presenting themselves. That might give you a clue as to, that they may need some help. Even with adolescents, they may not say, hey, I'm feeling stressed or I'm feeling anxious. You may see them being more snarky, or they might be more defiant or withdrawn. Again, sometimes just opening up that conversation and just like, hey, you kind of just don't seem yourself today. What's happening for you? Might be able to give them the ability to take a pause and maybe try to find a way to access some language to talk to you about that.
Yeah, and I think opening it up, I have 2 teenagers, and if I ask how school was, I get one of 2 answers, boring or nothing happened. So, trying to really then keep delving, well, what happened? What was good today? What might not have gone as well today? Were you, and try to stimulate that conversation, I think is a really good thing. I think car rides are a great opportunity to get your teens to talk. I have a no phones in the car rule. So that's when I hear everything. And sometimes I'll take a little bit of a longer route because they're talking. So I'm trying to get them to talk is a great suggestion.
And your point is well taken. Why car rides work is because you're not looking at each other face to face and you're not having a sit down at the table. Let's talk about the problem. It's, it's interwoven into, and when we get home, we need to do X, Y, and Z. And, how was your day? Like they're captive and yet it's not so intense, because I think for them, the intensity for at least adolescents is a little much.
I usually put those child lock things out so they can't get
They
out
can't
there
jump
and start talking. So those are great suggestions. How can we better recognize the triggers of stress and when things are starting to escalate? We've had issues here within our organization. I think a lot of industries with staffing shortages, and that's placing an extra burden and pressure and stress on other staff who are here. It's COVID has definitely pushed everyone to places we've never been. Patients sometimes we've noticed recently they're also struggling and stressed. We're having different interactions with patients than the kind that we used to. So what sort of things would you suggest to recognize escalation of stress and or some of those, when it escalates, maybe some burnout, suggestions on that?
Yeah, so the this is previous to the pandemic. Burnout was something that was a phenomenon that people were already experiencing. And I just kind of want to touch on the couple of things that we want to look out for if someone is experiencing burnout. Fatigue. So feeling as if you don't have enough energy, feeling as if you can't actually complete your kind of day-to-day tasks, almost as if your energy is completely depleted as a result of just going through what we would consider our like normal routine. That could be at home or also in your professional life as well. Almost as if you're feeling exhausted by the time the day is over or even prior to the day being over. And we're not just talking about like physical fatigue, it's also a mental and emotional fatigue as well, feeling really emotionally drained, almost as if like you just couldn't, right? You just couldn't like listen to anyone else's anything, even if someone was like, can I get water? And you're like, I can't. So fatigue is one of those symptoms, but that's not the only symptom of burnout that you're looking out for. Feeling, especially in like a professional setting, feeling as if your performance is suffering. You're just not able to finish tasks the way that you once did, maybe having that mental fog that's getting in the way. Not as sharp as I maybe have once been, or my problem solving doesn't feel like it's up to par as it used to be. And then there's also experiencing negativity towards what you're doing. So, right, having some cynicism towards what we're doing, not really having that pep in your shoe when you're like waking up and excited about the work that you're doing. I know personally for me, when it was in the thick of the pandemic and right, March 16th came along and we had to stay in our homes and I had to figure out how to do telehealth all of a sudden. And I had never done it before. It was hard being a therapist during that time. It was incredibly challenging to want to hold space for others when I felt like I had no space for myself, and didn't know who would hold my space, all of my stuff, right? And so I'm gonna be honest, I was like, should I continue being a therapist? And so those kinds of questions will start to show up. But I think the pandemic has actually put on a huge new layer that folks are also experiencing on top of these burnout symptoms as well.
Yeah, and Dr. Hayes, can you, what are your thoughts on how the pandemic has shifted how stress is experienced? Just to add on to what Zanal was saying, your thoughts on that?
Yeah, definitely. I think what we first saw in the beginning of the pandemic was fear and anxiety and not knowing what we were dealing with, not knowing how long this was going to last. But I think fear was probably the first kind of wave of an emotional process. I think then we hunkered down and started to, do the job, and then exhaustion probably kicked in. And then that led to its own stress, which is like, how long can I keep going with this? And we had a breather for a while and things got lighter and restrictions lifted, and then it came back. And then I saw a shift. People were no longer scared, necessarily physically exhausted. They might be a little mentally exhausted, but then there was anger. And I thought that was a kind of a surprising turn, that now there was a piece of like, now people are just mad that this is still going on, and their patience is much lower than it had been even in the beginning. In the beginning, I think we kind of all pulled together, and I think now that's the challenge. I would say more recently, the final kind of phase that I kind of see is almost kind of a disconnect, like a numbing. And I don't know if other people have experienced this, but I kind of see this with, in different situations of they're not even mad anymore. They're just kind of disconnected or things. A little apathetic. But I think I think Dr. Lewis, when we were practicing this, was going to talk a little bit more about kind of some of the very serious effects of like this chronic stress, how it can kind of take on in another layer. And that's kind of the piece that I worry about, is like the cumulative emotional toll that we have.
Thanks, Dr. Hayes. So Dr. Lewis, I think some of the things Dr. Hayes was referring to are things like, we've heard these phrases, compassion fatigue, moral injury. Can you talk a little bit about those and what those mean to us as healthcare workers?
Right, because even before the pandemic, I remember just speaking with a lot of staff, whether it was physicians or nurses, and there was this trend already going around that a lot of people felt like what they were experiencing wasn't burnout necessarily. So it was almost like, I'm getting a little tired of people labeling me as burnout or burned out. Like, that's not what's happening. And most of them were probably right. Like, that wasn't exactly what was happening. But the lines tend to blur with a lot of these other, labels, I'll say, of clinician distress. So you mentioned compassion fatigue, for example. That very much blurs with burnout syndrome because a large part. It's okay. Isn't that? I was like, I hear me, but I don't know if y'all hear me.
Try the other one. We need our moderator, our panel member, Todd from IT to weigh in here.
Secret member. Oh, there we
There
go.
it is.
That was really loud.
Todd
Okay.
just walks towards the microphone and it starts to work.
Isn't that out?
Okay, so Dr. Lewis, you were starting to talk a little bit about compassion.
Yeah, so compassion fatigue, and I was just mentioning, you didn't hear me in the back, how the lines tend to blur with a lot of these different types of clinician distress. So compassion fatigue is a very common one. And the best way I like to describe this one is actually how someone described it to me as, and we experience this a lot, especially in my line of work with palliative care, where you kind of start your Monday off, your new day of the week with this basket full of apples. All these apples of compassion, and each person you're going by and you're meeting during the day, whether it's a patient, a family member, a team member, a coworker, someone in the cafeteria, and you're passing out all these apples of compassion. And then at the end of the week, you look down at your basket and it's empty. You're like, where'd all my apples go? And it's like, and then how do I get more apples? I'm so exhausted right now. I don't even know how to go and get more apples. That is like compassion fatigue. It is that true emotional and mental energy depletion that can truly be felt at a somatic level. So you can see how, one of the criteria for burnout was emotional exhaustion. So yeah, there's a lot of overlap there. I think generally one key difference is that with compassion fatigue, clinicians can generally still get through their job without making mistakes. The concern with burnout is that there's a risk of the person actually starting to make mistakes during their job. Generally, again, the lines blur. Don't really see that much with compassion fatigue, at least that's per the criteria in the literature. The other syndrome or symptom that we saw a lot of, especially during the pandemic, but even before, is something called moral injury. And so this is when a person or a worker's morals and ethical beliefs are really being challenged at their job. So maybe they're being asked to perform their job in a way that completely conflicts with their beliefs. We saw a lot of that, obviously, during the pandemic. We're still seeing it. So our workers in the ICUs who are taking care of people at the end of life from COVID, and they just are denying on their deathbed that this is not COVID. I'm not dying of COVID. And like, why are you doing this to me? And they're feeling like, I'm trying to provide the best care for you and save your life. And someone's fighting them, I guess. And it's like, well, then how do I keep doing my job if they don't even want this kind of care? And it can be very distressing for that clinician. And then the last one that I'll mention, and Zanal, you kind of alluded to this a little bit when you were talking about adapting to working from home, is disenfranchised grief. And that's one that I don't think we really talk about, or that phrase is not really used as much. But this is when changes in our work environment actually distress us. So it's almost like you're grieving. I think the phrase, the quote is, you're grieving at work because of work. So like all these changes, one popular or one common reason that we'll see in the literature is the like explosion of technology, right? Like health technology, working with EMRs and figuring all of that out. The same thing with telemedicine. When we all had to adapt to that, it was incredibly frustrating. And especially if you've never done a telemedicine visit ever. And so that can be another label of distress. And that's different from, burnout. Burnout generally is determined or thought to be more due to someone's kind of own kind of traits and I don't want to say resilience, because obviously a lot of systemic and organizational stressors will contribute to a person's burnout. But with disenfranchised grief, it truly is like the work environment that is causing the distress. And then usually as those change, you adapt to a lot of the changes and you've been doing it for a while. Now telehealth probably isn't as stressful for you as much. That can actually start to ease the disenfranchised grief. And actually I'll mention one last one is PTSD. I mean, we probably all know that as clinicians, but even a lot of healthcare workers will experience PTSD-like symptoms, and especially those who are in the front lines in the ER or in the ICUs.
Thank you. So with regards to that stress, we had a great question in the chat window. Can you all hear me back there? Okay.
Yes.
How do you not feel guilty for these things? Because we're seeing people who are dying, cancer, all sorts of bad things that appear to be way worse than we are. And here we are feeling stressed about maybe our job or some other things. How do we cope with that stress and put it into perspective and not feel guilty? I mean, when we feel compassion fatigue, I mean, I'll admit there's been times you're on call. Back in the olden days when we didn't have work duty hour restrictions, when you're a resident working 36 hours at the end of your shift, you're just tired, right? The same person, the same problem comes in that you saw at the beginning of your shift. You don't feel the same. You're tired. I want some sleep. And then you start to feel guilty because there's someone who needs your help. And you feel guilty for feeling stressed. So how do we handle that guilt and that feeling amongst all of this?
I didn't know if you wanted to answer that, or I'll start and I think we can
Go ahead.
all talk to that. I think it is especially challenging when you're in a healthcare or a caregiving role or job to be able to recognize that you are just as important, and your needs and your self-care is just as important as being able to care for that person. And I know that it's a very trite saying that people say you have to care for yourself if you're going to be able to care for somebody else. But I think it's very, very true. Like you can't run your car if it doesn't have gasoline in it, even if you're going to transport people someplace. That's not a great analogy, but it really is. It's your well-being isn't at the sacrifice of someone else. You can't take care of other people if you can't take care of yourself. You're being compassionate to them because you're coming in with a full basket of apples. And so there is a mindset in when you are a caregiver that you are selfless and you are giving, but you can only give so much. And if you don't take care of yourself, there is less to give. So there really has to be a mental shift about that guilt and a challenge of that guilt. And being engaged in self-care is not being selfish. And even selfish isn't a bad word. We've given it a bad word, but we have to take care of our basic necessities to be able to really give quality care to other people. So if we care about other people, we actually have to care that we're taking care of ourselves. I don't know, that's my stab at it.
Thanks, Dr. Hazendahl. You had something to add as well.
Yeah, so as you were reading that question, the thing that popped into my mind was this idea of not feeling guilty. I think that it's okay to feel guilty. It's an emotion that we all experience, and the thing that we need to learn is how do I cope with guilt when it shows up? While also recognizing that, yeah, I'm exhausted and I want to go to sleep. And so I think it's something that needs to work together. It doesn't need to be one or the other. I can't feel guilty and take care of myself. You might feel both, and it's okay. So I think the piece that we really need to work on as well is giving ourselves permission to experience whatever shows up in that moment and learning to be compassionate to ourselves when a hard emotion shows up, because they're going to show up. The way that I tell my, people that I work with, all of our emotions, regardless if they're positive, neutral, or negative, they're giving you some kind of message about the situation. And what is that message? And we want to hear it so that we can move forward from it.
Thank you. Dr. Lewis, do you have any comments on how do you not feel, what do you do with the guilt? Because Sonal just said it's okay to feel guilty. Any thoughts from you on how to maneuver around that as well?
So I was actually just going to add a point more from just taking a bigger picture look at it with just the shift that we're seeing in how we practice healthcare these days. Wellness, of course, is like a buzzword. You can't turn around in any direction without someone trying to tell you to be professionally well. So there's a lot of that. But yeah, or guilt. but what's enlightening about it is that like many years ago, we were all about, in healthcare, a lot of the literature and the focus was on improving patient safety. And stick with me for a minute, I'm getting somewhere with this. But it was all about improving patient safety and like quality of care for our patients. And while we made wonderful strides with improving patient quality of care, the clinicians kind of got thrown to the side during that, right? Like patients. And yes, we should all be all about providing wonderful care for our patients. But now we're starting to see a shift where it's like a challenge to healthcare systems and organizations. Why can we not provide quality patient care and quality clinician care? Both can happen at the same time. And so I think as that shift and like more literature and research is coming out about this kind of beyond the scope of this talk, but just why that's so important, it's because they really do affect each other. So quality patient care is going to affect quality clinician care and vice versa. So as opposed to trying to just focus on one, the shift is starting to become the let's focus on both. So this is like an evidence-based literature standpoint. So I think that helps to kind of like shift some of the guilt. It's like, no, this is actually the future of healthcare, to take care of our clinicians and to take care of our patients. Because otherwise what we're doing right now is not sustainable. People, if they're burning out, people are leaving medicine. We're seeing this a lot with physicians. They're just leaving their medical careers to do something different because they are that exhausted with how medicine's being practiced. If we keep going like that down the road, we're not going to have clinicians. So I think there's a shift. And so hopefully just looking at it from a bigger picture standpoint can help to relieve some of that guilt, because this is the future of healthcare to take care of us as well.
Good comments. So let's go on to some of a new topic here. So we've talked a lot about stress, the effects, chronic stress, how the pandemic has impacted that. But what are the coping mechanisms for stress, and what can we do about it? How can we take better care of ourselves and each other? I'll open it up. Dr. Hayes is running for the microphone.
And
Oh,
passing
and
it right
she's
along.
passing it to
We've
Zanel.
already
So-
negotiated this.
So now, tell us your thoughts on this. What do we actually do about this? We can't eliminate stress, but how do we cope with it better?
Yeah, well, I think the first piece that we need to focus on is normalizing the self-care piece, right? Normalizing asking for help, wanting support. A lot of stigma is around asking for support and help, and we need to kind of break that apart. As an organization, as a family, as an individual, we really want to start kind of having a shift in our perspective in terms of what it means to ask for help or to try to take care of myself. So that piece is super important, and self-care or taking care of yourself can look in so many different ways, right? It might mean I'm going to just take a breather for a second and do some paced breathing. It might just mean I'm gonna go up and down the stairs because I'm feeling really restless right now and I gotta get rid of some of this extra energy that's stored in me. It might mean having a conversation with your primary care physician or actually seeking out a therapist that can help to kind of guide you through, the stressors that you're experiencing. We don't also want to forget our spiritual leaders. Finding comfort in your faith, finding support through your faith. Maybe there is a community that you very much are connected to. And so connecting to those particular communities and folks that are in that community can also help us relieve our stress. So there are different ways of coping, but to start to actually engage with some of that, whatever kind of biases or judgments we have regarding self-care and taking care of ourselves is a piece that we're going to have to kind of break down first.
Thank you. Dr. Hayes, what are your thoughts?
I think I would like to add in terms of managing stress, to focus on children and adolescents. And because I agree wholeheartedly with what everyone on the panel is saying in terms of how we can access resources and what steps we can take to manage our own stress. We're also modeling how we cope and how we adapt to stress to our children, to the younger generation and things like that. So one of the things that I would say, if you're looking at how do we manage the stress with our children, because children do experience stress, is again to kind of break it down to what's helpful for them. What's helpful for them is structure and having a routine and having predictability so that things, can feel safe. It's showing them how, teaching them, if they're starting to feel out of sorts and they're having a breakdown or they're having a fit or a tantrum, taking a moment, taking a break, taking a breath, teaching them some self-soothing kinds of skills. It's also okay to reach out to professionals, to, your pediatrician, your family doctor, to, ask about some other ways that you can help them, manage their stress, or reaching out to a mental health professional. Because of the pandemic, many things shut down and went online. And that was a dilemma for many people in my profession that deal with children and adolescents because we couldn't see them. We were not allowed to see them in person. And yet a lot of work can still be done virtually. A lot of work can be guiding the parents as to how can I help my child get through this difficult time? How can I structure our day, have things predictable, schedule in exercise, have a good bedtime routine? Those kinds of things I think sound very practical, but it really does, reduce their stress.
Thanks. Dr. Lewis, so how about from you, what sort of practical things? I mean, it'd be nice to go to a spa and relax for a day for self-care, but that's not always practical at all. So what would you offer as far as kind of that mind-body connection and helping with stress?
Right. And I think I'm glad you gave that example because a lot of people will equate those things like, oh, self-care means like just going to get a massage for an hour or having a spa day. And really I think of self-care and as part of your whole wellness it's a spectrum, right? Almost like preventative care. So I think of it almost, which is another trend we're hopefully becoming more focused on in our healthcare system, as opposed to just treating something when it comes up, starting to do the things we need to do for our health to even prevent that issue from coming up. So same thing with our self-care. So I'm going to be doing these regular things as a routine, just like you mentioned with children. You kind of have to, sometimes we need to go back and just remember what we had to do as kids and make ourselves do the same thing as adults, like put ourselves on a schedule and do things routinely as our own preventative medicine. So if I know that breathing practices and having a consistent morning routine is going to help me manage stress at work, then I need to keep doing that as opposed to just waiting until the stress is really bad and then trying to do it, or just getting back to the basics. Am I eating the right foods that I need to eat? Am I moving my body and being physically active? All these things that we know help to support our health, our physical, mental, and emotional health. Am I getting the right amount of sleep, the number of hours? How's the quality of my sleep? Do I need to do that substance use assessment? Am I maybe starting to drink a little too much? Or go to too many happy hours? Do I need to actually look at what my substance use is, especially if that has been a risk factor in the past for coping with stress? So kind of getting back to just doing that self-assessment of all these like basic pillars of health, like that's truly self-care. So looking at diet and exercise and sleep and whatever you do for your stress management, deep breathing, social connections, substance use assessment, all of those things should be part of our kind of well-rounded self-care assessment.
Thank you. I have one last question for you before I turn it back over to Eve. What do we do about the person that we're worried about? So we have a coworker, friend, family member, and we're worried about their mental health. How do we broach that topic with them without sort of scaring them away from maybe getting help that we think they might need or offering some suggestions? What would you say for that?
I'll tackle this one. I think what's really important is to talk with somebody about those concerns privately at a time that is not high stress, not real busy, and just talk to that person about what you're observing and what your concern is, and asking, how are you doing? I noticed you don't quite seem the same today. Is there something, do you need something, or can I help you with anything? So I think kind of bringing it up gently, but definitely having a conversation with them. And sometimes it's helpful to even share, with that person. It depends on what your relationship is. But if it's a coworker, let's say it's a coworker, it's also okay to say, I've struggled too. I can appreciate that. Like, we're all human. We don't escape this life without going through something. And so I think sometimes being able to appropriately kind of self-disclose a little bit of how you also might be struggling and what you found to be a little helpful might encourage them to either open up or, to be open to hearing some suggestions on some help or guidance, and then pointing them into that direction. Like, I do know if you're not comfortable talking to me, I do know, we have these great resources through the hospital. We have a wellness program. We have an assistance program where you can get these things confidentially and free, and just kind of giving them those things so they have those resources.
Those are good suggestions. Notice she didn't mention taking them in my car and putting the childproof locks on to get them talking. Zanal, do you have anything, or Dr. Lewis, to add to that answer?
Yeah. So I think everything that Dr. Hayes said, and I would also just validate their experience, being super empathetic to whatever experience that they may personally be going through, and showing just genuine care. Also just mentioning what the specific observations are. I've found that tends to be really helpful. So, for example, if you've noticed that somebody's isolating more or has been canceling plans, then I would just kind of go in with, "I've noticed, I haven't seen you in a while. I've noticed that you've been canceling our plans. Like, is there something going on? Do you want to talk about it?" Right? And so making sure that we're creating a space that someone feels safe to share their experience and to actually feel heard. Oftentimes, when someone's in the right mindset and is trying to actually help, but then go straight into problem solving, that can keep the person from actually sharing. So we really want to be able to kind of create an environment where the person feels heard and seen. And so that's the only piece that I would add.
Thank you. So we're going to wrap it up here, but just a few quick things, and then Eve has some important information as well. So I want to thank Zanal and Dr. Hayes, Dr. Lewis, for participating and giving us their sharing their expertise with us. And then also to thank Eve and Decla, our friends from Rush downtown, who helped us with this. And then Tracy Allen and Carrie Beckman from HR, who were also instrumental in setting this up. And then it goes without saying, one of our most important people, Todd from IT, who helped us out quite a bit. So thank you all for listening. I'm going to turn over to Eve. She has a few more important things to say.
So much. For everyone here in person and online, I just want to emphasize that we want to support you, that is what the Rush Wellness Department is here for. So whether it's connecting with me directly or more generally with us, I hope that you'll reach out if something resonated with you today and you're wanting to learn more. In the meantime, I do want to open it up for questions, both from our folks here in person as well as our folks online. So if you are online with us today, please enter your question into the chat. And if you're here in person with us, just raise your hand and we'll run over.
Thank you. Let me begin by thanking the panel for a very, very rich and timely discussion. My name is Daryl Jenkins. I serve as pastor of Faith Community Church. And my point of entry is not necessarily one as a clinician, but I'm coming in from the perspective as a clergy person. And that being said, I'm constantly seeing what has been described as themes: mental, emotional, physical, spiritual. And I'm constantly looking at the external as well as the internal. And so as what was described as perhaps disenfranchised grief. And so that being said, my point of raising now this question is, how might I, as a faith leader, bring awareness to the faith community, connect to the panel to receive the support that you all just referenced?
So I think this kind of goes with like normalizing these experiences that we're talking about. And if you have the opportunity to hold like a forum or some sort of even an educational kind of seminar group with your community, and kind of talking about what does stress look like for the community? What are their experiences? I think that's a really great place to start, because you're normalizing having the conversation, right? And I think that is a great starting point. And as people start to share and as you start to have more of these conversations, then you can start to slowly direct folks to different providers within the community, or kind of giving those suggestions of who else to talk to. I love hearing what other people do as coping strategies. During the pandemic, I have a love-hate relationship with running, and felt like I couldn't run during the pandemic because it was like, okay, I have to weave in and out, and this person's walking. Are they going to move? Oh gosh. So I constantly was just like, hey, what are you doing to like get rid of some of your stress? And so I got ideas from other people, and that could also be a starting point within the community of just hearing, how did other people manage things? Because we feel pretty isolated if we don't talk and connect with other folks, and you can also get some creative ideas as well. So that would be like my first kind of, step one in terms of how you can get something like that started.
Thank you.
So I think I have two questions, so keep them straight and anybody can answer.
I wasn't sure if she would. Did you want to comment? to my
No.
question?
She did a wonderful job.
Thank you.
Okay, all right, sorry. I am not a caregiver. I head up the HR function here at Rush Copley. My name is Carrie Beckman. And so two two pieces of stress that come up periodically within our function. The first one is we are not caregivers, but we are stressed. So we feel guilty because we're stressed and we're not caregivers, right? So people out there caring for people who are dying and in the middle of COVID, blah, blah, blah. What are we stressed about, right? So that's the first prong. And so how do we manage that, right? And give ourselves permission to deal with our own stress and feel okay about that. The second piece is a little bit different, but so we support caregivers, and at the end of the day, our work is never done, right? This is not a pitch for more staff. The work keeps growing. The staff does not, in general, and that's okay. But our work is never done. And so we begin to feel like we can't do a good job at anything that we do. And that creates a little bit more stress. So that's sort of the second thing. And so it's a different kind of stress, but you go home at the end of the day feeling like, okay, I did a whole bunch of stuff, but I don't know if I feel good about any of it. So those are the two things.
Before our panel answers, I just want to say one thing about the first thing, Carrie's first question. Excuse me. I orient the residents every year and I tell them every single person who works here it helps us take care of patients, regardless of whether they're not truly at the bedside, but every single person, and I go through and give them examples. I mean, our facility folks who are clearing the snow in the winter, if they don't do their job, we can't get to work and we can't care for patients. So every single person here has an important role, and in a way is a caregiver. They're just not doing it at the bedside, but they are helping us. So I just want to make sure that's really clear, because you may not feel like you're supporting patients, but you are, So I'll let you guys answer the harder part of that question.
Well, I thought that was an excellent point. And I think that I don't want that message to be lost on anyone, just how important every single person is. And whether you work in providing direct care or not, you're a human being and we're going through a pandemic and you're entitled to having your experience. You may not be stressed about patient care, but maybe you're at home and you're concerned about getting food or your finances, or like there's everyone is experiencing this differently, and all of it is legitimate. There isn't a competition as to my stress is more valid than yours, or my role is more important than yours. You're entitled to your experience, and it's real and valid, and you deserve to care for yourself around that. I think the piece, and I don't have an answer to it, so I'm hoping my panel will step in and help me, but what resonated with me when you were talking about you're on the hamster wheel and you're working and you're doing your job and you are doing it, but now all of a sudden you're not, am I doing it good enough? And, and again, what I would like to say, maybe this isn't great, but you're doing a good enough job and that's enough. Like we need to cut ourselves some slack during this time. And we need to be kind to ourselves and each other. And maybe it's not the absolute best that it could possibly be, but it's okay because it's good enough. And it's and you're important, and the work that you do is important.
That's great. Thank you.
I know we're right at time, so I'll make this very quick, as quick as possible. A couple things I just wanted to kind of add on, and then also kind of challenge like some of the wording that you use. So a lot of the distress syndromes that we mentioned up here and talked about today are not just for clinicians. So these are actually occupational phenomenon. So like even moral injury, that phrase originally came from soldiers in the Army. Yeah, so that's actually the origin of that. Burnout is considered an occupational phenomenon, not a physician phenomenon, not a clinician or nurse. So a lot of these things, yes, cross over with all work professions. We see them with CEOs, we're seeing them with all types of work. And then the last thing, like I think it's okay, and maybe this is just me saying things like, you can recognize that, yeah, we all know there are not enough workers, and so we're all doing the best we can. And so I know you're like, it's not a pitch to get more workers, like, we're just gonna keep doing the work. And it's like, well, no, you can say that's not okay. It's not okay that we don't have enough workers, but we recognize a lot of the organizational and systemic limitations, but no, that's not okay. But we're just gonna do the best we can with what we got for now, because that's all we can do.
I hope I'm not taking away anyone else's question, but I wanted to ask this question because a lot of my family members are in medicine. And my little sister works at Northwestern and she's been there 2.5 years. She's a nurse. She's working in the unit right now. And last week she told me she is leaving Northwestern to pursue a travel nurse. So 5 members of her unit left for the same job. I know that Rush is probably dealing with that too, but what kind of advice might you have for someone on the unit or working in healthcare, thinking about leaving the work that they love? 1, because they don't feel supported. 2, they're not being compensated for what they should be making. And 3, the support is no longer there. So for someone who really cares about that and really cares about good nurses, which is really hard sometimes to find, what kind of advice would you have for, you don't have to be a nurse, you can be even working at the hospital, right? But you don't feel supported, you don't feel valued, and you just don't have the right support. So I really wanted to ask that question for anyone who can answer that.
I don't know if people have seen some of the articles that have been coming out in a lot of other like magazines or like news blogs about how they're like labeling this era or time that we're in as the Great Resignation.
Yep.
Has anyone seen that? So it's not just within, and it's not just physicians, nurses, it is all types of work. The issues that organizations and businesses were experiencing as far as, low professional satisfaction, lack of autonomy and flexibility, and all these things that we know through literature that support people's professional well-being, that was happening before the pandemic. We know that crises have a tendency to just expose and magnify problems that were already existing. So now we have this horrible pandemic, and now it's just like, we're just seeing all the after effects now of things that were already occurring. So I would just say, this is probably going to keep happening. It's stressful because the people who are staying obviously are feeling more work. It's also kind of a little exciting because I think it's challenging organizations and businesses to go about how they practice their business differently, and that includes hospitals as well. So I think it's kind of exciting, that we're going to see a lot of changes because work professionals are not tolerating the things that they were tolerating 10 years ago, or 5 years ago, or 2 years ago. So yeah, I think it's something that's going to keep happening, but all of this is about self-care and wellness, and so obviously people are just more focused on their quality of life now. Maybe they were before, but now they're really focused. So people are making bold changes these days. So I think it's something we're going to keep on seeing.
I know that we're out of time, but if I could just specifically answer the question about the nurses and what could we say to them so that we don't lose them, is I do think, and just like what we're doing with all of these forums, is I think we're really trying to open up a discussion about, let's hear what you need. And there are resources available to you. And so if you're in a position and you're not feeling supported by your administration or your department, let's have a conversation about that. What could help that be better? Because we don't want to lose people, and the grass isn't always greener on the other side. And so somebody, might be envious of a bonus here or there, but really, if you love your job, let's see how we can make that work. And with all of the resources that we're trying to put in place now with wellness, we might be able to find a solution to that so that you don't feel that your only option is to leave.
Right. Well, I'm going to wrap it up. I want to thank again our panel members and our audience. So I hope you all found this helpful. Thank you very much.